We were talking about the NHS there with John Rentoul, who doesn't agree with me about very much of anything at all. 4.52 million people on waiting lists for routine procedures such as hip and knee operations, the highest number since records began in 2007. Which, of course, is when the Labour Party were in charge, right? Nearly 250,000 have been waiting for more than a year. Many are stuck in limbo, reliant on painkillers and unable to get on with day-to-day family life or work. It is absolutely imperative, I say, that the NHS is reformed. And I need to hear from you. A lot of you have already called in to talk to us about the NHS and your experiences of it. Because many people who use the NHS think it's great. But an awful lot of people realise how very sort of unwieldy it is, like an oil tanker, how difficult it can be to get a proper appointment, how difficult it can be even right now to see a general practitioner, a GP. Let's talk now to Dr Kristian Niemietz, Head of Political Economy at the Institute of Economic Affairs. He wrote a paper a little bit earlier on this week which caused ructions amongst those who think that the NHS is some kind of religion. Kristian, a very good morning to you. Welcome.
Good morning, Mike.
Thanks very much indeed for joining us. You really sort of set the cat amongst the pigeons earlier this week. I was pleased to see, because I'm with you on the idea that lots of parts of the NHS are simply not fit for purpose.
Yes, that's right. I mean, I get this response every time I write about the NHS. I was not entirely surprised by the reactions. It was a bit bigger in scale than normally, but this happens every time. There is this defensiveness around the NHS. I was making a fairly simple point in the report. I was simply saying, if you look at outcomes around the world, there is no reason to believe that the NHS has done a better job than any comparable healthcare system. That's all I'm saying.
No, quite. But also, I was arguing with John Rentoul just before you came on earlier from The Independent, because he's a great defender of the lockdown policy. But my belief is that during the coronavirus epidemic, which of course has put terrible strain on the NHS, there have been decisions made by the people who run it which have been wrong. You know, the Nightingale hospitals, for example, the fact that they were sending loads and loads of people home because they were somehow tracked and traced with people. You know, coronavirus in a hospital should be in a hospital, but what it shouldn't be is able to spread in a hospital because they have PPE, they have all sorts of reasons why. And yet they somehow managed to infect 26,000 patients with coronavirus who went into hospital for something else.
Yeah, there were lots of health policy decisions that certainly made things worse, especially early on the decision to shift a lot of older patients into care homes without testing them first properly, without making sure that the care homes had the capacity and the means for social distancing and protection. And there's lots of those decisions that contributed to the high death toll that we've seen. Of course, defenders would say, yeah, well, that's not the NHS, that's the government's fault. But I don't think in a system like the one we have, you can so neatly separate the health service from the government. It's a feature of the system we have that political decisions are so important. And if you don't want that to be the case, then you have to make the case for a different system, for a less political and a less politicized system.
Yes.
A system
Well,
that's more decentralized.
That's the tragedy, isn't it? Because the people in this country who are like Angela Rayner, absolutely wedded to the idea that you can't criticise the NHS because it means you're being horrible to nurses, which is such a ridiculous argument, it's not even worth making. But they all think that anything that happens that's good, for example, the vaccine rollout, that's all down to the NHS. But anything that happens that's bad, like the number of people dying, is all down to the government. And they don't see any irony in that.
Yeah, it's very much a form of cherry picking. They're saying the NHS would be perfect if it had the right kind of government, if we had the government that I favor in charge. But that's just the way it works in a democracy. Sometimes you have a government that you don't like. And ideally, then you should make a case for a healthcare system that isn't that dependent on who exactly is in government at any given time. Because we don't see this in other sectors. We don't say, oh, the supermarkets are suddenly worse. That must be because we have the wrong government. No, supermarkets are just run independently, and therefore it doesn't matter who's in government.
Well, that's right. So what are you making then of Matt Hancock and his plans for reform? Because, you know, a lot of people are saying this is the wrong time, that he should be doing this now, but surely now is the right time to do it.
Yeah, I skimmed through the white paper yesterday, and what's curious is in one of the first pages they say the one thing we want to avoid is yet another top-down reorganization. And then the rest of the document describes just another top-down reorganization. This is mostly just a reversal of the last top-down reorganization, the Health and Social Care Act of 2012. They're mostly now just reversing that. They are dissolving some organizations within the NHS and setting up new ones, but this is all rearranging the chairs, the deck chairs on the Titanic.
Yes, absolutely right. I mean, as far as looking around the world at other different systems which are used, because you're right to say that very few have copied. In fact, I don't think any have copied the NHS in the way that it works. And it was set up in a time when we were a very different country with a lot fewer people and probably a lot fewer diseases to cope with as well. So, I mean, what would you say is something that they could do quite simply and quite quickly inside the NHS, which would make it more effective?
All right. Well, I don't think there's any quick solutions. What I've been saying for a long time is I'm a fan of the so-called social health insurance system that they have in the Netherlands, in Switzerland, and various other places. A system of competing insurers and lots of competing healthcare providers where you have free choice. And if you can't afford your premiums, then your insurance premiums, the government will pay them for you. So these are universal private insurance systems. I've been a fan of that type of system for a long time, and you could, without major disruption, convert the system we have into a system of that type. You would have to introduce free choice of the so-called clinical commissioning groups, which are these local organizations that allocate NHS funding locally. These are effectively like health insurers already. It's just that right now you have local monopolies everywhere, and you can't choose your clinical commissioning groups. I would introduce free choice there, and I would also open that up to the private sector. If you want to opt out of NHS commissioning altogether and go for a private alternative, you should be free to do that.
Because I understand in places like Germany, there is a much more sort of private-public sharing of resources and sharing of jobs, if you like. Because one of the reasons I'm told that the test and trace system worked a lot better in Germany was because the private laboratories were much more efficient than the Public Health England laboratories, which were very centrally based and very slow and cumbersome.
Yes, that's right. And one of the people who developed the test, the COVID test, made that argument as well. He said he was initially working with Public Health England, saying initially both the German system and the British system were initially on the right track. But what made the difference was that in the German case, it was led by market forces and it was therefore quicker. It was scaled up a lot more quickly. Right. They're starting from very similar positions, but then because of differences in the way the healthcare systems are organized, in the German case, they just raced ahead.
Yes, and I mean, I'm puzzled as well by the whole Public Health England situation, because I seem to remember some months ago Matt Hancock getting up in the House of Commons to declare that he was abolishing Public Health England and replacing it with something else, but it still seems to be there.
Well, and I'm afraid it's still going to be there for quite a while, if not under that name. But you can see this in the white paper. There are various references to, nanny state measures as well. So this is something that one of the problems is that Public Health England the whole time has been more concerned with calorie labeling and advertisement for burgers and stuff like that, and what they call junk food. And there's quite a bit of this nanny state activism in the white paper as well. I think this is where we will see the next incarnation of Public Health England. But they've been spending more time on that than pandemic preparedness, and I think that's not going to go away.
No, I think they love this idea that they tell people to protect the NHS. I mean, we're never going to lose that now, are we? Protect the NHS, don't drive your car in case you crash it. Protect the NHS, you're okay cycling because that's quite healthy. Protect the NHS, stop being so obese. I mean, they started that campaign this week.
Yeah, and this slogan, stay home, save lives, that was, I read a bit about the origin of that. That was a slogan that was widely used. Lots of governments around the world used it. And the peculiarly British version of that was that they had to put in save the NHS. And one of the people who was involved with that campaign then said, well, it worked so brilliantly because it had the name of this organization that everybody reveres. But okay, in that particular case, I'd say if that's the way to make it work, then who am I to criticize it?
Well, I mean, I'm glad you're criticising it. I hope you continue to do so. Dr. Kristian Niemietz, thank you very much indeed. Head of Political Economy at the Institute of Economic Affairs